my screen. So welcome to our co-op panel. This is a little bit different than our normal speaker events, but we're really excited to have some great student panelists join us today. Just as like a general, if you're new to Vital, we're a healthcare innovation club here on campus, and we typically do speaker series, and we have a case competition in the spring, and we recently have a new ventures team. So if you're interested in the more consulting side of things, one of our panelists is actually helping out a little bit with that as well. But yeah, if you're interested in Vital like outside of this event, please reach out to us and we'd love to kind of tell you a little bit more about it. But without further ado, I will let the panelists introduce themselves. So we're going to go down the line. So Celia, you want to kick it off?
Yeah, hi. Okay, so I'm Celia. I'm a third year health science and business major, minoring in psychology. And I just finished my first co-op, which was with Mass Challenge Health Tech, which is a digital health startup accelerator in Boston. And I was a marketing intern there for my co-op.
Awesome. Thank you. Max?
Hey everybody, I'm Max. I am a third year. I'm a computer science and math combined major with a minor in biology. Last co-op, I worked at Genentech as a data analyst in the development science informatics department. And as a data analyst, I worked on a lot of developing a lot of machine learning models. So machine learning engineering, specific in natural language processing and kind of creating structured data from unstructured data.
Awesome. Mega?
Hi, I'm Mega. I'm a fourth year. I'm currently on my second co-op. So my first co-op was at Mass Pioneer. I was a clinical co-op just working in ophthalmology. And for my second co-op, which I'm on currently, I wanted to do something a little bit different. So I'm actually working at a consulting firm based in Boston called Delira Health. And basically I'm doing strategy consulting. So working with different clients, assessing market opportunity, stuff like that.
Awesome. And Alia? Oh, I think you're on mute.
I'm so sorry. Hi, I'm Alia, and I'm a third year bioengineering major. And I'm currently on my first co-op at Selux Diagnostics, which is basically a medical device company working on rapid antibiotic susceptibility testing.
Awesome. So thank you all for kind of giving a little bit of background. So just kind of like jumping straight into it, do you guys want to talk a little bit about the major things you did or are currently doing on co-op right now? So like anything that you found particularly interesting or something that you really liked working on. So Celia, you can start it off.
Yeah, so my primary responsibilities as a marketing coordinator were running social media accounts for the startup accelerator, writing a lot of blog posts and other marketing activities such as planning events, both internal and external, virtual and in person when we were in person. So definitely my favorite thing of being at the accelerator was being able to like meet and talk to like all of the founders. The program ran from like January to June, and we had 27 health tech startups going through at that time. So I would have the chance to like meet and talk to them, to write blog posts, and also kind of to be like a little bit of a mentor to them and help them out with like marketing related activities. So that was definitely my favorite part of being there.
I'll go next, I guess. Some cool stuff I did at Genentech. Oh man, I did a lot of cool stuff. I loved my time working there, being in San Francisco. Like I said, I worked on doing machine learning engineering, so I was building natural language processing models for data scientists to use. That was the coolest thing I did there. We worked with a natural language processing architecture called BERT, which was developed by Google, there's a couple of iterations on it now, but is widely considered the top of the line, state of the art natural language processing model to date. Got really good performance on the model. And then after that, I continued to help other interns that came on. So I led a team of 5 people developing natural language processing technologies, creating documentation and restructuring the machine learning pipeline within the department. So introducing, sustainability within our machine learning pipelines, reproducibility, accessibility, stuff like that. It was a lot of fun. Also talking to a lot of people at Genentech. They were just absolutely amazing. The location's amazing. The campus they have is fantastic. And I ate a lot of food. The food was good.
Awesome. I can go next. So basically, like a big part of my job, so I'm an analyst. Basically, the way consulting works, it's project by project. So for example, we just wrapped up about an 8-week project with a client. So I can give you a little run through of like what it was. Basically, this is a pharmaceutical company, a biotech company, and they came to us to basically determine market access strategies and if they're thinking of manufacturing a certain drug for pain management. So they wanted us to kind of give strategic recommendations as to how to proceed in the market. So a lot of my job is working like super closely with the other project managers and other analysts and associates on the team, just creating deliverables. We did a lot of primary interviews with doctors and pharmacy directors and stuff like that. So it's definitely a lot of secondary research, just like analyzing the market again and then making deliverables and presenting to clients and stuff like that.
I can go next. So basically, we are a medical device company, and we currently have 2 machines that are undergoing clinical trial right now. So my biggest role in my co-op right now is basically I'm a test engineer, but that branches off into a lot of different things. So it's kind of an underemployed company, so they give me a lot of tasks to do. I think the coolest thing I've done so far is software testing, and that's basically where our external manufacturing company will give us software updates that we've requested for, and I basically just install that on our machines and make sure that what we've asked for is received. Something else that I've been doing now that I'm like more acquainted with the machines, and I think this is one of the major things I enjoy doing, is commercial testing. And basically, once our machines hopefully pass clinical trials, we'll undergo steps to make sure that the machines are good enough for commercial use. So I've been writing methods so that the next test engineer, probably the next co-op, will follow the steps and make sure that it can go through FDA approval.
That's super cool. Thank you all for going a little bit more in depth about your co-ops. They all sound like great experiences. So I guess starting out with Celia, how did your co-op change your view about the area of healthcare that you worked in, or just kind of what you want to do in the future?
Yeah, so I'd say for me, I have been health science and business for a little bit over a year, but I really didn't know like what that meant until I really like worked in it and like did my co-op. The health science part of my degree is kind of what I'm really passionate about, and the business part is kind of like the reality of what I see myself doing, because I never really wanted to be clinical or be a doctor. So I think being able to work in more of like a business environment, but with like a healthcare focus, really showed me that that's what I want to do. And I actually just transitioned from being like housed in Bouvet to housed in Demore McKim, which isn't that big of a deal, but like for me it is. And then also just kind of being exposed to being around like healthcare innovation. If you had asked me what a startup was 9 months ago, I probably would have thought it was like some computer programmers like sitting in a basement in Silicon Valley. But like I realized that like it means a lot more than that, and really any company is a startup, and it's really cool to be in that area of healthcare, which is such like a big field.
Yeah, what I learned having gone through my internship, what did I learn? One of the bigger things that I learned about healthcare, well, especially my, like I said, my internship, my co-op was focused in data analytics. So I didn't really work in like clinical trials. I had a lot of friends that were working in clinical trials for Genentech, but you know, I had firsthand experience with seeing what kind of data was being used in natural language processing at Genentech, and how the different types of processes that they're doing with data analytics. And kind of going into it, I never really thought of the huge breadth of, I knew that there was a vast amount of data that, there was in healthcare, just from clinical trials, from research. The amount of data that you could get is just absolutely massive. But I didn't know the breadth of which the analytic tools they were using on said data. So while I was working on natural language processing, I know a lot of people who were doing machine learning models to do digital pathology. Some people were doing blur detection using a program called like HistoQC, which essentially would take all they worked on was taking pictures of cells and tumors and was doing blur detection, detecting if the picture was blurry or not. And then if the picture was blurry, they're like, we can't use this, send it back. That's all they did. But like the capabilities and the wide breadth of tools that they used within healthcare and within data analytics of healthcare, it was just fascinating, the amount of things that you can do with all the data they have. So yeah, the thing I think I learned the most about was just the wide breadth of analytic tools that are used within healthcare.
And like kind of taking that in a different direction, I think just in general in healthcare, like there's such a wide breadth of key stakeholders and just like there's so many different intersections of healthcare. So like that's kind of something that changed for me, is especially coming from a clinical co-op to a more like business focused consulting co-op, just seeing like the difference between like who you're talking to, who your clients or your customers or your patients are. I think it's a really interesting way to see how many different people are involved, versus you have obviously like your doctor-patient relationship, but then you have like the regulatory side, you have the financial side, you have the drug development side. So I definitely think, at least at my job, I get to see a lot more of like what goes into what we call like our healthcare system. So yeah, I think just like, and that can be a good and a bad thing. I think sometimes, I mean, I'm sure you guys all know there's like, we have in general, our healthcare system has some flaws. And I think just getting to experience, like, for example, like talking to insurance company executives, talking to pharmaceutical manufacturers who's like, and some of their end goals are money, some of them not so much, but just like getting to see those different aspects is definitely something that I've gained from this job.
Yeah, building off of that, I also learned from my co-op that there's just such a diverse set of skills that people bring into healthcare. So as a pre-med student, I always thought healthcare was just like doctors, nurses, PAs, and everyone in between. But once I got to this med device company, I was working with like an electrical engineer, a mechie, an algorithm engineer, and obviously you have like your microbiologists and chemists. And I thought that was really cool and important, because especially like during this pandemic and probably in the future there'll be other serious illnesses. I think it's important that you have that diverse range of people so that you can have like different opinions on certain diseases, which I think is important.
Thank you for that segue, because my next question is about COVID. So I know a lot of people are super worried about about co-op positions being available in general, because I know that some people are looking right now, but a lot of people were in the middle of their co-op. So how did your position change due to COVID? And if you did have to do any kind of virtual work, how was that and how did you adapt to it?
Yeah, so I was in the middle of my co-op when COVID kind of happened and everyone went virtual. So that was definitely kind of weird to transition. I went home and was working from home. But in terms of, I think it was honestly really so cool to be kind of just where I was, and just in general being in the healthcare field, like while that was happening, was a cool place to be, not a cool situation to be in. But especially just being in the middle of like all these entrepreneurs who were literally like at that moment, like pivoting to focus on the pandemic. Like we had some of our cohort like literally creating like tests and distributing them. So like that was a really cool place to be, and like really cool to see happen like right in front of me.
Yeah, my position changed a lot. Well, sorry, not the actual work that I was doing. My location changed a lot. I went across the country. It was very far. Um, that was the biggest thing that changed for me. Like, I know a lot of people um, talk about how like maybe their position changed and they really struggled with transitioning online. While there was a bit of a barrier, transitioning to online, um, I wasn't doing clinical work. I'm computer science and math. I like was strictly doing data analytics. Um, so I was already doing all my work from a computer anyway. Talking to people was just a nice touch. But going home, nothing really changed much about my job. But kind of piggybacking off of what was said, uh, being within healthcare during COVID was really, really interesting. Just seeing how Genentech dealt with the COVID situation, the phasing back to work, and not only that, but also shifting some of their clinical research to COVID-specific testing. It was really interesting seeing some of that stuff in the newsletters. But as for work went, it was just more like personal and mental stuff and mental, barriers to jump over. Functionality within the companies remained the same. It was just, how do I stay busy? How do I not go crazy? How do I, remain productive and still, find that work-life balance when everything is at home.
Yeah, and so I guess I kind of have like I'm in like from a different point of view because I started my co-op virtually. So my co-op started in July, and obviously we're still in the middle of the pandemic. But that was like the middle of the pandemic. And honestly, I think like I remember like the first 2 weeks, just like I'm not gonna lie, like it's hard because, and I actually talked to Hino about this. It's hard because I think when you start any job, regardless of what it is, just having to have that virtual relationship, you don't really know the personalities of the people you're working with. They don't know you. So it's definitely an adjustment. But after that 2 weeks, I would say like, and like kind of like what Max was saying, like my job is pretty much all computer based. Like we do client calls via Teams anyway. So I think being virtual wasn't like it wasn't like a huge change from what my job would have been. Obviously, like going to the office is like nice, but yeah, for me, I don't think that it was that big of a huge difference.
So I feel like my experience is really unique because I do get to go into the office every day because it's a lab-based position, and they've cut down the capacity by like half, so there's only 20 people in the office. But yeah, definitely it was nice to not start virtually just so I could actually be trained well. I couldn't imagine doing it virtually, any of my lab training. But I think it's also quite sad that my company has no plans to do any COVID testing, I guess. They're very adamant on just pushing on with the antibiotic testing because, like I said before, it's a small company and there's not enough space to do more research on COVID. So yeah, COVID didn't affect my company too much, except it did push clinical trials back a little bit just because there's a ton of miscommunication when you're doing meetings over Teams sometimes, and a lot of people don't really respond to emails and stuff like that. So things just slowed down, but other than that, we're just pushing on.
So in more of a high level, just like not necessarily like your co-op specific, but it could be like based on like the industry you worked in. How do you kind of see the industry potentially changing as a side effect of COVID, or is there anything that you think that they should do?
Yeah, I mean, I feel like it's kind of another side benefit of being in healthcare during COVID is I feel like a lot of my friends who like lost their co-ops and such, like, I mean, healthcare is probably the most stable profession to be in right now. But in general, I think it's interesting to see how things will change after this because a lot of people figured out there's a lot they could be doing that's virtual that they always thought that they had to be in person. So I think in general, the industry will be affected by that because it's honestly possible that a lot of people will never go back to work as it was before, just because it's cheaper, it's easier. So yeah.
Yeah, I agree. I mean, this example obviously is in healthcare, but like in the news, like as COVID started, Facebook and Twitter said that like even after COVID's over, they would have people strictly working from home. And I think that's a shift that not just healthcare, but all companies are going to be making once COVID is over. You know, they're seeing that, you know, you can still remain productive if you're working from home, if you're working through Teams or whatever you're doing and staying on top of emails and just staying productive. If you're keeping people accountable, or you already had a sense of accountability and you're keeping a level of trust, then, you know, you can do anything online that you're able to do in person. With, you know, that's of course my case with like I was saying before with computer science. It's easier than a lot of other jobs. Obviously, if you're doing clinical work, you can't like be doing clinical work online unless you like fill like a lab with robots and then like everybody like has a controller at home. Just an idea. But yeah, it's, you know, I think once COVID's over, people are just going to be started working from home permanently.
Yeah, definitely. I think there's definitely something to be said though. And like, so we're actually developing a case competition. So plugging HHIC 2021. But one of the things that we were discussing was telemedicine and the one, barriers to use, and two, what do we think like the ramifications or like the benefits from COVID, I want to say, will be for telemedicine in terms of just like usage and implementation. So I think, I mean, just even speaking like strictly clinical, I think we're at a really interesting place right now to see if doctors and providers of the sort want to continue working in person as practice has mainly been conducted over the past how many ever thousands of years, or versus like shifting to like a more telemedicine, more virtual based practice. And obviously like that's case by case basis, but I think just in general for like the healthcare industry, I think it's a really interesting time we're in right now.
Honestly, I agree with everyone. I'm not sure what to add, but like obviously diagnostic companies are just going to invest more time in the COVID vaccine. But as someone who like is a test engineer, there's just so many random errors that can come out of nowhere. So I just think that people just need to make sure that the vaccine is actually ready, because you know sometimes companies are not very ethical and it can get kind of icky. So I don't know, just making sure that's okay. I don't know.
That's super fair. So going back more onto like your co-op specifically, has your co-op changed your plans for the future? I know some of you are pre-med, some of you aren't at all. So maybe start out with that a little bit and then, yeah, just let me know.
Yeah, so kind of like I said before, I'm not pre-med. I've never wanted to be pre-med, but health was always something that was very interesting to me. So definitely my co-op kind of solidified that I'm really interested in that business side of healthcare and also kind of the innovation entrepreneurship side of healthcare. I think I could be really interested in working for like a healthcare startup in the future. But at the same time, I'm like in the process of looking for my next co-op, and I'm looking at other areas like healthcare consulting where like there is like that intersection of healthcare and business. So yeah.
I have no idea what I want to do. Yeah, but Genetech was a great experience. It helped me find out a lot about, you know, machine learning and also what like data analytics like is like in healthcare. Like I was talking about the wide breadth of data analytics that goes on with the data they present. How did it shift what I want to do? I would say that the size of Genetech more so kind of shifted what I want to do for my next co-op, or at least for my future. I definitely want to work more in the strain of like a startup or like a smaller company, because Genetech's huge. And like, while it's fantastic, While it's fantastic, the thing that I realized about healthcare, and especially pharmaceuticals, is that the pipeline's massive. Like, it's like they talk about how long it takes to develop a drug on a team. It's like 12 years. You have people who are working at a company and they're like, yeah, I've been here like 30 years. And I'm like, what? And I don't know. And personally, that may be appealing to somebody else, and I completely get that. But, you know, in the current state that I am, that's not as appealing. You know, I kind of want a lot of variation in the projects that I'm doing, and a lot of changes in, perspective. So definitely in the future, maybe working for a smaller company, whether or not that's in healthcare, I'm not certain.
Kind of like, so I am, or I could be pre-med, right? Basically, so my first co-op was like your run-of-the-mill clinical co-op, working with patients. It was awesome. It was a really great experience. I would highly recommend if you guys are pre-med, if anyone's pre-med, to do a clinical co-op. I think they're really important. But I was kind of at a place where I was like, I want to see what else is out there, see what else I can do in healthcare. And like, honestly, that's when I found Vital, and like that's when I started working at my co-op now, and it's like been a really great experience. But so honestly, right now I don't know, and I think that's something that's really great about this club, and just like somebody was saying about the breadth of healthcare professionals and how many people, like how many different skill sets people bring to the table. There's so much within healthcare you can do. So I don't know. I'm kind of trying to figure it out, and we'll see. I'll keep you guys updated.
So I am also a pre-med student, and I think that my engineering co-op has kind of pushed me more in the direction of becoming a doctor. I do love my job, but I've noticed from my co-op and some of my other friends' engineering and STEM co-ops that usually as you move up the ranks in your company, you tend to do more managerial positions. That's what I see at my company. And you basically, as you go up, you just attend more important meetings, you fill out more forms and documents, and that's something I can do less of. Like, I'm still more interested in doing the actual testing, doing the actual problem solving, and yeah, just being in the lab, doing hands-on things. So the engineering field appealed less to me because I feel like moving up in the ranks is not appealing, but that is something I want to do as I'm older. So I thought, I've always wanted to be a doctor, and it just strengthened that more because obviously when you're a doctor, it's all hands-on. You get to actually talk to the patients and not just a robot every day. So yeah, definitely going to stick to pre-med, and I'll probably look for a clinical co-op for my second co-op.
Awesome, thank you. So while I do have more questions, I'm gonna first open it up to the students to kind of see if there's anything that anyone has questions on yet, or it could be for the panel in general or a student specifically. Feel free to unmute and you can ask, or you can just throw them in the chat and I can ask them as well.
I have a question.
Yeah, go ahead.
So some of you are working in like smaller companies, and some of you are have worked in like big companies like Genentech. Max was also kind of like talking about the desire of switching projects. So I was wondering, like, how easy or how much freedom did you guys have in terms of like trying to switch to projects? And do you guys have any tips to give to the student regarding switching projects if you ever want to? And
I can start. The one thing about co-op specifically is that it's only 6 months, or like maybe 8 if you extend it. You know, obviously it's fantastic that we get to do 2 of them, but that's just the fact it's 2 over a 4 or 5 year time period. It's very short, and so I feel like for my co-op at least, when I started, they were like, you're doing this project, and how you finish it very much up to you. we're going to give you a lot of responsibility, but this is what we see as the end goal. And I feel like that's kind of a good, at least in my position in pharmaceuticals, where they're very much based in larger projects, longer timelines, having key results, sub goals to reach a larger goal. That was good for my co-op. So I didn't have as much flexibility in what I was working on per se, but just because of the nature of it, and I'm fine with that. But because of, they gave me a lot of responsibilities and a lot of side projects too. Like I was talking about earlier, when I finished developing a machine learning model, that was the main project. Then after that, a lot of it was, I kind of took on a more of a leadership role, taking the knowledge that I had gained, because I was the first person to develop a BERT model. So we had 5 new employees that came on, and I began to teach them, and they kind of just asked me like very general projects like improve machine learning pipeline. And I did the research on my own to learn how to we switched over from Roslyn to AWS systems and databases using data version controls, jargon. But yeah, no, I would like more flexibility in the projects that I'm doing, but because of the nature of it, it was a lot of fun just because of the amount of responsibility and the flexibility within the project that I had.
That's very interesting. Thank you. Anyone else?
Yeah, I can add to that. So I am at a small company, and just the nature of where the company is at and how fast paced it is, I also don't really have a say in what I want to do. Basically, the minute I got there, clinical trial was like the next big thing, and there were so many little steps that just had to be done before we got there. So I have asked for different projects, but honestly, the machines are like, especially engineering, everything is just so complex, and it takes about 2 weeks to fix one small issue. So sometimes you just have to like attack what your supervisor gives. And if they're nice enough, like mine's super nice, he has allowed me, like once clinical trials is over, to join a different machine team. So definitely just always give your supervisor a heads up, and he should work it out.
Mega, Celia, do you have anything to add, or should we move on?
Sorry, did I cut you off? Okay, I was just gonna say mine's more of the same, kind of at like a different angle, like as a co-op, especially like this is my first time like business co-op, like I'm an analyst, so like I kind of just do what they tell me. Like it's not really something where it's like, I mean, I'm sure if I really wanted to be on a specific project or like in a specific work stream, I could do that, but yeah, I haven't asked, but I haven't been put on like a specific project that I asked for.
I guess I can chime in because my experience is actually a little bit different than you guys. I feel like I was on a really small team. It's like a medium-sized company, but it's a smaller team, the health tech team. And I think one of my favorite parts is that I was very much encouraged to kind of like speak up if there was something that's going on that I really wanted to be a part of. A lot of it was like kind of like quick, shorter term, not when I say short term, it's like 1 to 2 months. So like in 6 months, like you can be like kind of bouncing around doing a lot of things. Actually, it was 8. So I would say that I did really like being in an environment where it was kind of like a lot going on, but at the same time, like I was in marketing, but I was encouraged to speak up if there was something going on with like our partnerships that I wanted to work on, or there was something going on with like the actual curriculum for like the startups in the cohort that was going on. Like I was encouraged to kind of help out with that. And obviously kind of the same thing, like being a co-op, you kind of like, you do what you're asked to do, but just that type of environment was really awesome.
Great. Does anyone else have any other questions?
I guess I can go. So I'm actually in the process of applying to co-op for the first time. So I was wondering if you all had any advice about other students looking to find their first co-op and how you ended up deciding on the one you have or had. Yeah.
Celia, go.
I'm so sorry. I would just say advice would be persistent. I mean, right now especially, but in general, like I had friends who got co-ops super early, and I also had friends that got co-ops December 15th. So I wouldn't get discouraged. Like it doesn't always go very well. This process, my first process was like pretty easy for me. But it really doesn't always go that way. And the second process already isn't shaping up to be that easy. So yeah, it's hard, but don't get discouraged.
Yeah, I definitely agree. And like going off of that, I know it's like so cliche and everyone says it, but like I think one of the biggest things, and I tell myself this every day, is like like a big part of your co-op is for it to be a learning experience. And I think any job you do and any job that like somebody offers you a position for, like there's something to be learned from it. Just like I had a clinical job and like that it had its like it had its upsides and downsides. But I think like overall, like you take away so much from wherever you are because you're there for 6 months. Like yeah, it's a short time, but that's also 6 months. Like that's longer than a semester. So like I think just like yeah, like what Celia said also, like it can get discouraging sometimes, but just like keep applying, like keep talking to your co-op advisor, and then like just like know that wherever you end up, like you will end up taking something away from it.
I think when I applied to my first co-op, well, yeah, I'm on my first co-op, but basically, I strongly believe that my company really only cared about my personality mostly, because my lab skills were just from classes. They were the same as everyone else's. But I think they know it's more of a entry to intermediate position. So they just want to make sure that you get along with your coworkers. And I've just noticed that because like my company is super fun, super chill, everyone gets along. So I think that was important for them. And then from your first co-op, probably just take note of all the skills you're learning. And I think probably your second co-op, they will definitely care more about your skills. So I think it's important to keep track of those.
They all said everything. The last thing I would say is like I know a lot of people who kind of like last minute were looking at positions like and kind of were very eager to like jump on the first position that gave them an offer. Like I don't know, just there's always there if it doesn't like feel right, or if like you know you won't want to work somewhere, but like you're nervous that you won't get another offer, you'll get another offer. You just keep applying, continue to trek through the horrid valley that is applying to jobs. But like you will get another offer. You will get something that you enjoy. Just just like don't like compromise for something that you don't want to do.
That was really reassuring, everyone. So thank you.
Does anyone else have any other questions? We're all students, so don't be like nervous to ask.
I have a quick question for Max, actually. So being that you're at Genentech, could you kind of describe where your role and your work that you did kind of fit into like the long scale like drug process that you were talking about, especially like the big company at Genentech?
Yeah, so I was a little cog in a big machine, a very big machine. And so where we sat, I could draw a diagram. They literally, I'm not even joking, on the first day, they're like, here's a flow diagram. This is where you sit within the company. And so they had like GRED, which is pharmaceuticals and study and research development. And we're underneath that essentially. And Genentech is a subsidiary of Roche. So and GRED technically communicates right with Roche. So technically I worked for Roche, which is pretty cool. But DevSci Informatics sat within like a sat underneath research development, except it wasn't clinical research development. It was just data analytics. And so primarily what our department did was we developed tools for researchers to use to assist clinical research. My tool specifically was, I was developing, like I said, developing natural language processing models for what's called like an annotation tool. So we had a bunch of toxicology reports and assay reports that were unstructured. There was no systematic way of doing like a lookup based off of the drug that it talked about, which is, I think, is ridiculous. The company let that happen. Whatever. There was no systematic lookup for like the drug that you wanted to find information about. So researchers, like for a large majority of the drugs, were just flipping through papers and wasting time trying to figure out information. And so what the model I made was it's called named entity recognition. It essentially did a search for drug names. And so it would go through an unstructured data and it would label every single string or token that it recognized as a drug name. And when you recognize the drug name, you're able to make an accurate estimate. We added that to what's called our annotation tool. And so researchers could look up, could say like, I want to look up X drug. And then so it would say, okay, and then it would do a search based off of a database that was populated using the named entity recognition, which essentially said all of these papers have a reference to X drug. And so while it wasn't perfect, maybe, it was much better than the current process that it had. So that's specifically what I did. A lot of other people developed tools, like I said, that did digital pathology, blur imaging, and higher resolution actually. So they would recover the blur of specific images, and they would increase the resolution using machine learning models. So improve the pictures to be able to see features within the picture. So the data analytics was essentially, we created tools that helped assist research, helped increase the speed of the pipeline, and helped make clinical trials a lot more accurate. Did that answer your question?
Yeah, you did. Thanks. That's very cool.
I actually have a question if no one else has any right now. So I'm in a position right now where the co-op that I have, I didn't really have, or I didn't think I had the background experience for. And so I was kind of like super nervous going into the interview. And I mean, I'm currently working it and I love it, but I did feel a little bit like a sense of imposter syndrome because I'm like very pre-med and I definitely want to be a doctor, but I'm actually working Celia's current position. I am a marketing co-op at Mass Challenge Health Tech currently. But how did you kind of adjust to your co-ops? I don't know if like you had like all the applicable background experience, or maybe not even this one, maybe for your next one or your previous one. How did you kind of adjust to that? Because I know like, especially like our younger students, like when I went into my first co-op, I was like, I don't know what I'm doing. I have like zero skills, but I guess I could do something here. So yeah, I don't know if any of you have any input on that.
Yeah, I mean, sorry. I was just gonna say I can go. I would say, I mean, it was my first co-op, so I like literally had no skills, or no experience, not no skills. I have some skills, but I had no experience. So that was definitely kind of hard. And I think like my biggest thing looking back, like the reason, like how I knew that I kind of like grew was that I remember I would send my boss like every single email that I sent out to anyone. Like I would be like, can you read this? Can you tell me it's an okay email? It would be like 2 sentences long, but I'd be like, you need to read this first. And then obviously at some point I stopped doing that because I just kind of like got a little bit more confident being able to email people and like reach out. And honestly, translating that back kind of just into school even, like I feel like reaching out to my professors or like advocating for myself, like with my co-op advisor or my advisor, it's not like I wouldn't have emailed them before, but it's just like a lot more, like it comes more naturally to just kind of like be able to advocate for myself in that way now.
I was in the exact same position when they hired me. And then they hired me, and then I found out the work they were asking me to do. I'm not joking. I went back and looked at my resume to see if like I put anything that was false information. I like accidentally, like, but no, I had no experience. I had never made a machine learning model before, and it's like not like just like it's kind of a straightforward thing, but like it took me a while to figure it out. Like I'd never made a machine learning model before, never used AWS. I'm good at programming, but like I'd really just done that. I hadn't done any heavy Python scripting before. That's another thing. If you're applying to co-ops, also, like, don't feel discouraged if you don't meet a lot of the requirements. You'll figure it out. You will figure it out. But yeah, no. I literally going into the position, I had no experience. Um, I had no experience with machine learning models, but like, coming into it, I then began to feel super comfortable after a while, learning about how about developing machine learning models and everything I had done with that. And at the end of the co-op, I'd learned everything. So yeah, if you feel imposter syndrome, don't worry. Yeah, you'll figure it out.
Awesome, thank you. Does anyone else have any questions that they want to ask? It could be about anything. It doesn't have to be about their co-ops necessarily, if you're interested in their majors or anything like that. Oh, someone asked a question. Okay. In the same vein, do you have recommendations for good questions to ask during interviews for first-time co-ops? That's a really good question. I still struggle with those.
How are you doing today? Nobody asks that. I don't know. Just like, how are you guys doing today? It's like, I'm good. I always ask like how the two main ones to ask somebody are, how do you like your job? Because if they say they don't like it to somebody they're interviewing, don't take the job. And the second one would be, how did you get to your position? Kind of like what their career path was like. It's really interesting to see how people got to where they are, because nobody has like a straightforward career path. Nobody's gotten to where they are by like, there's no book and it's like, yeah, that makes sense. That's how you should have gotten there. And also, people like to talk about themselves. So, they'll be like, oh, thank you for asking. Let me tell you,
One of the questions I always ask is kind of along the lines of like, what expectations do you have of me, like of my growth in this co-op, like, and kind of like going off of that, like, what do you hope I'll learn from this co-op? Because I think that that's a really important question for you to determine if it's a good job for you. And second, I think it shows that you're interested in growing and you're interested in learning skills and picking up skills that you can take in this career and in other careers. So that's just something I always ask.
This is a small thing, it's not a question, but sometimes you'll be put in a group interview like I was. So like I think 4 or 5 people interviewed me at once. And this didn't happen to me, but definitely keep note of what their names are, because it'd be pretty embarrassing if you didn't know their names and it came up, and they probably wouldn't like think that's a good thing. So yeah.
Awesome. I guess in the same kind of general path, I'll just ask another question because there's no more in the chat currently. Do you have any general interview recommendations or tips just for first time, second time? I know for second time co-ops, often it's like you're playing a game of how much do I talk about my first co-op and like how to relate it. So I know some of you might be going through that right now, or you've already done that. So how did you play that balance? I guess it depends on the position itself, but from your experience.
Okay, so I'm on my second co-op right now. And they're like completely different worlds, my 2 co-ops. One of them is obviously clinical in the hospital working with providers, patients. The other one is like working with like business administrators, working with obviously like life science people also, but like, sorry, I lost track of the question. The question was, how do you like, just 1, general interview tips, and 2, like, how do you kind of talk about your first co-op? Okay, cool. I mean, I think any experience is really valuable experience, especially if you can shape it in a way that is bringing you to your second job. Like, for example, like I said, and like this is true for me, it's like I really enjoyed the clinical aspect, but I wanted to see like who else is involved in the healthcare system, like who are the other players, how do you create the most change. Like provider patient relationship is a very individualized relationship. How do you stimulate change beyond that? Stuff like that. So just like taking things you learned again from your first co-op and like framing it in a way that is applicable to your second co-op. I think that is something really important you can do.
I would say general interview tips, just because like I kind of am in the middle of trying to figure out the second part of the question. But general interview tips is like kind of like what Alia was saying. A lot of times, I mean, obviously it's about like being like you do have to have some of the right like skills, or not always skills, but like I don't know, sometimes it is a little bit about like your experience or skills, definitely, but at the same time a lot of it is about like culture, and like culture to like most places they want someone they want to work with, so like remembering to humanize yourself, and like I've caught myself doing that like recently in interviews, there's like being like so like gung-ho about like talking about experiences and stuff, but like just remembering to like humanize yourself and like talk about things you actually like to do, like talk about like if there's an organization you're in that you're like really passionate about, like people love to hear that.
Going off of that, also just make sure you can explain everything on your resume really, really well. And because I remember when I did my interview with my company, I had like all the usual skills and experiences, but all they asked me about were my hobbies. They were just like, oh, you do yoga. Like, what do you like about yoga? Or like, you have a food account. Talk about that. They didn't even ask about like research lab or whatever. So even if it's like your little hobby section at the bottom, definitely just know how to explain those really well.
Awesome, thank you. On that just reminded me of my last interview. This is like, I know I'm like answering my own question, but be prepared for random questions, because I got asked if I commit a crime, what would I do? So I really think that sometimes they like just want to see, like, it doesn't even matter what the answer is, it's more just kind of like how you explain yourself. I had another person ask me like, if you would. I said shoplifting, specifically from Lululemon, because the prices are just too much for me. I mean, I got the job, so I guess it was like an okay response, but I think they mostly just want to see your thought process. But and someone I used to work with, her like go-to question was always like, what kitchen appliance would you be? And she like genuinely thought about like what the person would say, and also like, what food would you be, like if you could be a food, and she would take that response into like heavy consideration based on like the thought process. Like, she didn't care if you said blender, it was more just kind of like, why are you a blender? Are you a mess? Like, are you chaotic? And that was that was essentially like the thought process there. But awesome, thank you all so much for answering all those questions, and we just kind of fired them at you. But before we wrap up, does anyone else have any like last remaining questions they want to ask? You can put them in the chat, feel free to ask them. If not, I can just transition into talking about our upcoming events. Alrighty, I'm going to take that as everyone's all set. But of course, like if you are particularly interested in any of these positions or the people, the panelists, please reach out to us. We will definitely help put you in contact with them. They're all very sweet, and I'm sure they'll be happy to answer any questions you have, either about their positions or just about like their majors and how they got to where they are. And then a few little housekeeping things. I'm going to share my screen. We have a few events coming up. So this date is wrong, I'm so sorry, but the first one's supposed to be October 15th. We're doing part 2 of our Digital Health Speaker Series, and we're bringing in one, Amy Van Haren from Pump Spotting, who is going to be talking about her company, and Sarah Cooper from Med Rhythms, who works more on the product development side of things. And they're both going to be talking about mental health in relation to digital health. And on the 29th, I'm so sorry again about that date, we have the third part of our digital health speaker series, and it's focused on data in healthcare. And we're collaborating with the Industry Pharmacists Organization for that. So that's super exciting. Doesn't necessarily have to be about pharmacy and pharmacists, but we are bringing in a few speakers to talk more about the data science aspect of healthcare. And on the 12th of November, we are bringing in a leader in healthcare. So we'll release the speakers of those like as we get closer to the date, but definitely a lot of very cool individuals that we're going to be bringing in, and you'll get to hear more about their experiences in healthcare as well as what they're up to, especially post-COVID and amidst COVID. And yeah, thank you all again for joining us, especially to our wonderful panelists. We really appreciate you answering all of our questions, and we hope to see all of you at our next events. If you ever want to kind of know what we're up to, you can follow us on Instagram, email us, or join our newsletter, because that's a really great way to find out what we're doing. But yeah, awesome. Thank you.